going back to my hypothetical female practitioner, I can understand why they might be very worried about giving the wrong impression to a patient who's come in. And I can remember from years back, female practitioners talking about patients who've had wearing boxer shorts and had an erection during treatment and things like that. And that's not a comfortable place for a female practitioner to be in. Anecdotally, one patient actually ejaculated in the middle of a sitting manipulation, which, again, that would be a bit of a surprise to most practitioners. And we do need to avoid people putting themselves into danger like that. But perhaps we'll come back to some more interesting stories that you've encountered in your time. Sam says, from a comms and consent perspective, this is fascinating, as we perhaps don't have so much honesty in our treatments. In fact, we probably have more of a power imbalance than your speaker does. Fascinating. I'm not saying we should change anything, it's just an observation.
Just going back to what you said, really, about the fact, he ejaculated in that and other scenarios, that I think, I get that it's not an ideal situation for a practitioner to be in.
You've got to wash the towels and everything.
just inconvenient at the least. But why is it wrong?
Well, that's...
Why do we make these,
Interestingly, that when
I think someone flirting and, touching a leg, like that's about, actually that's not we're doing the blah, blah, there's a way around that. But actually, if someone's in a situation where whatever was happening to them caused that much arousal that they ejaculated, other than it, being an uncomfortable situation because it's not something we're used to.
Yeah. That's a really interesting take on it.
Why is that? The clients I work with, that happens.
It's a really interesting take on the situation, because from the time that was first mentioned to me way back when I was training as an osteopath, we were all thinking, oh, God, that's awful, that's totally inappropriate. But I guess that is our presumption that the patient in some way wants to act out that sexual urge with the practitioner. But as you say, if it's just a natural reaction to what's going on, then we shouldn't be criticising, blaming or shaming them for that, should we? But
that's where it's the communication, because we've assumed that they've assumed that we've assumed, rather than just kind of it's happened. There's all sorts of situations in life that turn people on. Role play situation. There's all sorts of things in life that turn us on, that make us excited. Yeah. And a lot of those things we hide because we're in this culture that says that that's not okay. Yes, we need to have professional boundaries, but I think there's an aspect of how do we decide what's right and wrong in a practice. Yes, people have got to be safe, but actually if we had more of these conversations, we'd probably feel a bit safer, because these things are right in the air and we're not second guessing all these different situations and scenarios that we may or may not find ourselves in.